I think there likely will be a variant that will be trouble in the future. And actually, by the way, there's already, we know about a subvariant of a sublineage, let's call it, of Omicron at the moment, BA2. We're not particularly worried about it, but just to sort of Dr. Evans just to mention just how how we've just got to stay on top of this all the time. BA2, if you look at the case rates in Denmark at the moment, is spreading very, very rapidly. There's absolutely nothing to suggest that the vaccines aren't effective against it. It seems it's just as contagious as the original Omicron, BA1. But it's a reminder of the importance to stay vigilant, but also to stay vaccinated.
It's really helpful because, that being said, and we've heard it time and time again, moving to live with the virus. So what plan does the government have to avoid going into various lockdowns and to have a broad consensus of how we put measures in place for the future, should we need them?
Yeah. As I've said, the Prime Minister said we've got to learn to live with COVID. I think we're learning more all the time, and we've put a lot of that into practice over this recent Omicron wave. We will, first of all, we'll be setting out, hopefully, next few weeks, a sort of plan in the spring, by the spring, a plan on how we think in government that we can learn to live with COVID as a country. And
that's really true. So you're going to come forward with a variant plan, which would have different, what level we put in masks, what level we put in social distancing, what level we need to close schools, all this. Can you talk us through how it would look? I wouldn't describe it
as a variant plan, or even necessarily on the kind of measures that you suggested there. But I think it will set out, taking into account everything we've learned over the last couple of years, what is it that we know is most effective, and then also understanding that. In the early days when we had the sort of lockdowns and things with the pandemic, that what are the sort of the knock-on non-COVID impacts of that as well on things like education, so children's schooling, college and university education, people's life chances, not going to work in the usual way, and all of that, and also the non-COVID health impact as well, your mental health impact, for example. So I think the things that we will focus on will be absolutely the pharmaceutical defences. So vaccines, I think, are with us to stay indefinitely, and I couldn't tell you today how often we would recommend a COVID vaccine, or exactly to what cohorts we would, but I don't think they're going away. Antivirals and other treatments, which again we have today for COVID that didn't exist when we first learnt about COVID, and also testing, I think, will continue to form a big part of our response. So those three things I would sort of put the top of the list: vaccines, treatments such as antivirals, and testing. My department will lead on this. I will lead on this as the lead minister, but of course it will draw in from across government. It will be a government response to how we learn to live with COVID. And I've said, and I think I've said it recently just in the House in my last COVID statement last week, that we've got to find a way to live with it in the same way, let's say, we live with flu. And I'm not for a second sort of saying it's like flu. It's look at sadly all the deaths we've had from COVID, over 150,000 from the start. It's about understanding we do now have defences which we didn't have before, and just as sort of flu doesn't stop society and stop life, we mustn't let COVID do that anymore.